Hello, and welcome to our podcast where we will focus on a multifaceted intervention to reduce unresponsible opioid use in Ohio. Today's podcast is brought to you by your hosts from the Global Public Health Scholars Program, Nithya and Brooke. Today we are going to discuss a case study dealing with opioid prevention in Ohio. Ohio has the 5th largest rate of drug overdose deaths in the United States. In order to decrease deaths associated with drug overdoses in Ohio, the government's Cabinet Opioid Action Team implemented multiple interventions to combat drug use in 2011. The strategies that they implemented included promoting responsible opioid use, reducing the supply of opioids, and supporting overdose prevention by increasing naloxone availability.
There are many strategies the Cabinet Opiate Action Team used to assist with the 3 types of interventions they implemented. Such interventions consisted of closing pill mills, introducing a drug take-back system, and public health campaigns. The Cabinet released 3 guidelines on the responsible use of opioids. First, Emergency Department/Acute Care Facility Opioid Prescribing Guidelines. Next, the Opioid Prescribing Guidelines for Treatment of Chronic Pain. And finally, the Prescribing Guidelines for Treatment of Acute Pain. The results from the case study were quite remarkable. The unintentional drug overdose deaths involving prescription opioids have reduced from 45% in 2011 to 22% in 2015.
81 million fewer doses of opioids dispensed to Ohio patients in 2015, compared with 782 million doses dispensed in 2011. It was, however, mentioned in the study that laws and regulatory changes alone are insufficient to address the crisis of opioid overdose deaths in the United States.
Considering that the Governor's Cabinet Opiate Action Team implemented a multifaceted intervention and even stated that laws and regulatory changes alone are insufficient, which implementation is the most sustainable for reducing opioid use? Promoting responsible use, reducing the supply, or increasing naloxone supply?
In order to address this question, we must first discuss this case study more thoroughly to understand hardships that go along with treating opioid abuse, the societal views of opioid abuse, as well as the pros and cons of implementation strategies.
Our special guest with us today is Erin. She's the Deputy Director of Policy in the Center for Substance Use and Health Research, known as CESAR, in the College of Behavior and Social Science at the University of Maryland. She has been a part of CESAR since 1997 and has more than 20 years of experience in researching substance abuse and misuse. With that being said, please welcome Erin.
Okay, hello, I'm Erin Artigiani. I am Deputy Director for Policy at CESAR, the Center for Substance Use, Addiction, and Health Research at the University of Maryland. We are a part of BSOS, and CESAR has been conducting policy-relevant research in substance use and misuse for more than 30 years now. And I have been a part of CESAR projects and programs since 1997, and I've worked on a lot of program evaluations and implementations and strategies and things like that during that time.
Thank you. So the first question we have today is we sent you the case study, and we're just kind of wondering what are your thoughts on the interventions and strategies used to address the opioid epidemic in this case study?
I think that the interventions and strategies used in Ohio actually were quite cutting edge and comprehensive for the time when the study was conducted. And in fact, many of those kinds of strategies are still used in communities across the country today. But I do think that they reflect a lot of the initial approaches that were used to address the opioid crisis, and that the field has grown in important ways since the study was completed. So for instance, there is now a growing understanding of the role of polysubstance use in the drug crisis, and also in the need for recovery infrastructure to support those working towards and in recovery.
Great, thank you. And I know you talked about you had some sort of like role in the Mountain Maryland Forward. I was just wondering if you could kind of expand on that whole.
Sure, I am actually PI of the Mountain Maryland Forward project. That's a project that was funded by the Department of Labor Work Initiative. And that project actually builds on the success of local recovery, prevention, education, and treatment efforts by collaborating with local community-based organizations and employers to provide training and support for people in recovery as they work to rejoin the workforce and become productive members of their communities.
Great, thank you. And then from your knowledge and experience from researching substance abuse from various different places around the country, how generalizable do you think the results are to the rest of the country?
I actually think that the results and the recommendations that were made in the case study are definitely generalizable, and that strategies like those used in Ohio can benefit a wide scope of people. And as I mentioned, there are many places that are using strategies like those today as well. And so, for instance, almost everyone recognizes the value and importance of naloxone now, and important steps have recently been taken to increase naloxone and access to naloxone, such as making it available over the counter. And as another example, a jurisdiction I work with in Western Maryland implemented and continues to pursue strategies involving pharmacists and disseminating information through pharmacies, and particularly focused on proper drug storage and disposal information. And so that includes activities like information printed on bags and included in fact sheets that are given out with all opioid prescriptions that are filled in pharmacies in that county. And this also is used to encourage pharmacists and their customers to talk to each other about drug use and drug interactions and disposal and all those kinds of things as well.
It's a great idea. Not even thought about or noticed that that was a thing going on. But I know that you've also managed a number of prevention strategy evaluations. So from your experience and research, how do you think the prevention strategies listed in the case study compare to other prevention strategies? So like to be more specific, compared to the other strategies, do you think these are good or effective approaches?
Yes, I do think that the strategies in the case study can be valuable and effective, but I think it's important also to understand that much like there is no one way to treat diseases like cancer or diabetes, there really isn't one way or even a best way to respond to the drug crisis or substance use disorder. And really, the type and potency of drugs available change constantly, and people often don't know exactly what they took. So all of this makes it really important to utilize more of a toolkit kind of approach that would allow for local providers to work with the people they serve to develop customized treatment and recovery plans that would meet individual needs. And I think that that kind of approach, that kind of individualized approach, can be reinforced by and also reinforce strategies like some of those that were implemented in Ohio.
Yeah. And then what intervention strategy do you believe is the most sustainable, promoting responsible use, reducing the supply, or supporting overdose prevention, like increasing Narcan availability?
So I don't think it's a one or the other kind of a thing. I don't think you focus on just one type of strategy, because it's really not about one thing or one size fits all. It's about meeting people where they are and really treating and supporting the whole person. And so that goes back to what I was saying earlier about a toolkit approach. And you really need that kind of approach so that you can pick the approaches and the strategies that are most suitable for the clients you serve, and then also be able to adapt those strategies and approaches over time to reflect changes in drug trends and community needs and resources. And so in looking at Ohio and what they've been doing since the time of that case study, for instance, the Ohio Action Team included all three of those kinds of things and seems to still be doing that. And when I worked with Maryland state agencies 20 or more years ago now to develop action plans to address the drug crisis at that time, we also were careful to include actions that could be implemented in many different kinds of strategies simultaneously. So prevention, treatment, reducing the supply, education, and research. And then now, for instance, if you look at the current 2022 National Drug Control Strategy that was produced by the Office of Drug Control Policy, They also encourage the use of multiple types of strategies to expand access to evidence-based prevention, harm reduction, treatment, and recovery services, while also working to reduce the supply of harmful drugs. So you really have to come at the crisis from multiple directions.
Thank you. That was very helpful because our whole group has our main question was what's the best, most sustainable intervention? And from talking with you, it's just very nice because we kind of come to the conclusion that you can't really have a sustainable intervention without including multiple interventions. So thank you for that.
Absolutely, yes.
And just a final question, it's kind of a two-parter, but what is the significance of government enforcement or policies in the success of the study? And do you think that involving different type of stakeholders, such as healthcare leaders and rehab programs, would be less effective in reducing opioid use?
Well, my colleagues at CESAR and I have always felt that the key is collaboration, and the more the better. So it's important to involve as many stakeholders as you can, because everyone can play a valuable role in addressing the ongoing drug crisis and supporting those in recovery. And the more avenues you have for getting information out and for reaching people, the more successful you can be. And so you can really do it through all parts of a community. And I've seen that in action through the work I do. You can work through local youth groups and community centers. You can work through religious organizations. You can do programs through schools and all different classes, not just health class, but all different kinds of classes. So again, you're just having a continuing conversation with people, because the more normal you can make it to discuss drugs and drug use, the less stigmatizing substance use disorders will be, and the less stigmatized people who have those disorders will feel. So and then, of course, the better you'll be at supporting those in need and getting them the services that they need.
Thank you. Just like a question I thought about while you're answering that is, what age do you think is kind of like the best age to really introduce awareness about just substance abuse in general?
I think the earlier the better, because I think that kids are very observant and very aware of what's going on in their homes and with people they love. And but I think it can vary also depending on the community you're in and the kids you're dealing with when it's best to bring it up. But I think just being open to them asking questions and looking for information and being able to talk to them when they reach out to you is the best approach to take. We, in the past at CESAR, have provided education programs in many different types of school settings, high school and middle school. And I think we've even done a couple grade school programs as well.
Thank you. Well, that's about it for the interview. So I just want to thank you for meeting with us, but just also for all your work in CESAR and just research around substance abuse in general.
Well, thank you very much. I appreciate the opportunity. It's always nice to be able to talk with young people like you who are putting so much thought into substance use and misuse and how to address the crisis that we're in today.
Thank you.
With the highest opioid rates being in Ohio, the Governor's Cabinet Opioid Action Team implemented 3 interventions to promote the responsible use of opioids, to reduce the supply of opioids, and to support overdose prevention and expand access to naloxone. The interventions' results proved to be beneficial. Unintentional drug overdose deaths involving prescription opioids have reduced from 45% in 2011 to 22% in 2015.
As a team, we questioned which of the 3 interventions would be most sustainable. However, after discussing and hearing Erin's input, we have come to the conclusion that opioid overdose cannot be lowered with one intervention. It takes multiple resources, stakeholders, and policies to combat this crisis. Erin has even made it aware that these interventions, especially increasing naloxone, are quite common in other locations besides Ohio and can be very long-lasting.
Overall, from reviewing this case study and talking with Erin, we collectively learned that sometimes it's not about one perfect intervention, but multiple interventions that work cohesively to create a large change.
As we conclude today's podcast, we would like to thank Erin once again for joining us today. We love listening to your input today, and we thank you for all of your hard work in reducing unresponsible opioid use and deaths. Finally, we would like to thank our listeners for taking the time to listen to our podcast. Thank you.